Okay, today I will cover the kidney and kidney or renal pathology. Renal pathology has a huge list of pathology, and here I ended up to I, but there are more. So the renal pathology, let me start with the congenital first. If you look at this, there's a huge list of congenital anomalies. Congenital anomalies means the baby born with that. And one of these is renal agenesis. Then let's talk about what is renal agenesis. Renal agenesis means the kidney did not form. Kidney did not form. Kidney is absent. And that kidney absent could be unilateral, could be bilateral. So if the kidney or kidneys are absent, then we have to understand that what does the kidney do? The kidney produces urine. Then what is the effect if kidney does not produce urine? Then we have to understand what is the other functions of the kidney. The other functions of the kidney is kidney maintains the homeostasis, means it maintains the electrolytes in the blood, in the body, and it maintains the blood pressure. And if kidney does not produce urine, it could be before the birth of the baby. If it is before the birth of the baby, that means then amniotic fluid in which the baby gets bigger, and the amniotic fluid will be very minimum. We call it oligohydramnios. And this oligohydramnios is a dangerous and fatal condition, because the oligohydramnios, most of the time it is associated with Porter syndrome. Associated with Porter syndrome. Then what is Porter syndrome? Porter syndrome is agenesis of the kidney, means kidney did not form, neither one. That means both kidneys are absent, and there will be oligohydramnios, and pulmonary hypoplasia. Pulmonary hypoplasia means lung will not be bigger, small lungs. So baby cannot survive after birth if baby has Porter syndrome. That is impossible. So that's why renal agenesis identification is very important for the fetal evaluation. And it is a protocol image to show the kidneys are present or not. So now, renal agenesis could be unilateral and could be bilateral. Unilateral renal agenesis means one-sided kidney is absent. So, what is the effect of this? I'm going to say, if this patient doesn't know until he or she is dead, so there will be no effect of absence of one kidney. Why? Because the other kidney is active and functioning, so other kidney will have compensatory hypertrophy, and other kidney will be working more, and there will be enough urine production, blood pressure, electrolytes, all will be maintained. So patient may not have any signs, symptoms. if patient has only one kidney. But the incidence of one kidney absent is more than bilateral kidney absent. So bilateral kidney absent definitely will have some symptoms. So how early the symptoms are present? In fetal condition, you will see baby has no kidneys. If baby has no kidney, so then what happen? Amniotic fluid will be very small. We call it oligohydramnios. And if kidneys are not present, so then urine is not formed, so the bladder will be empty. And amniotic fluid is very less, so then baby will try to swallow amniotic fluid, but it is very small, so stomach you may not see it, because when the baby swallow amniotic fluid, the amniotic fluid goes into the stomach, and you cannot see the stomach in the abdominal circumference. And you will see the lungs are very small, hypoplastic lungs. So if the lungs are small bilaterally, so what would be happen? The transthoracic circumference. Thoracic circumference, thorax will be smaller. So thorax and abdominal circumference, they maintain a ratio. Okay, if abdomen is 100%, the thorax, at least it should be not less than 77%, usually 89%. Thorax is little smaller than the abdomen, but in this situation, in hypoplasia of the lungs, the thorax will be very small. And what else are you going to see? You will see the facial changes. Patient will have flattened nose, low set ear, and the two eyes are more close, hypothyroidism, and receding chin, means it will be like a small chin and it's coconut size shape. So these are the feature of complete agenesis of the kidney. So they will ask couple of questions from this renal agenesis. Number one, unilateral and bilateral renal agenesis. Which one is more common? Unilateral. Which one is compatible with life? Unilateral or bilateral? Unilateral. Patient may not detect that they don't have kidney, but which situation is fatal? Bilateral. Which agenesis, uni or bilateral, is associated with hypoplasia of the lungs? Bilateral. Which one is associated with the Porter syndrome? Bilateral. Which one is associated with oligohydramnios? Bilateral. So now, renal agenesis. Now little another level discussion. Renal agenesis means no formation, no kidney, no urine, right? But if the situation happens like that, there are kidneys, but those kidneys are non-functioning. What do you mean by non-functioning?
They don't work.
It doesn't work. That means no urine is produced. If no urine is produced and agenesis of the kidney, the same thing. So, if they ask, is it always true that kidneys are absent and patient has Porter syndrome? No. There might be both kidneys are present, but kidneys are non-functioning. So that is equivalent to Porter syndrome.
Okay.
So now, another condition. Kidneys are there. Kidneys are functioning. But there is obstruction in the bladder neck, so that baby cannot pee out the urine into the amniotic cavity. So then what gonna happen? The amount of amniotic fluid would be down, low, again oligohydramnios. See, number one, we found that there is no kidney. Number two, we found, okay, number one, there is no kidney, no urine. Number two, there is a kidney, but kidneys are non-functioning, so no urine. Number three, there are kidneys, kidneys are functioning, but the urine is not coming out into the amniotic cavity due to obstruction. That's why it's very, very important in the fetal life to see the kidney, to see the stomach, because the baby swallow and the stomach is filled with amniotic fluid. If you see adequate amniotic fluid, that means kidneys are functioning. And kidneys, image of the kidney is very important. Image of the stomach is very important for the fetal part. And image of the bladder is very important. And the amniotic fluid volume index are very important. If kidneys are there, kidneys are functioning, but the fluid production, amniotic fluid is very minimum. It is not oligohydramnios, but it is less. But if hydramnios, the amniotic fluid is adequate, we call it polyhydramnios. Patient may have, or mom may have, a small amount of amniotic fluid. It is almost oligo, but not oligo. Then we have to think, is that kidney is functioning but not functioning 100%? Or is there any leaking of amniotic fluid from the mother and the amniotic fluid is minimum? So that section will be dealt by in OB section, OB. But our part is whether the kidneys are there, whether the kidneys are functioning, and whether there is obstruction of the outflow tract. So that much evaluation in abdomen you need to know it. Okay? So now we're going to discuss about the ectopic kidney. Then what is ectopic kidney? Ectopic kidney means ectopic location. What is ectopic location means? Away from
the regular location.
Away from the regular location. That is ectopic. Okay. So now let me, because I need a space. So you wanna write down this part and this part.
Yeah.
Yeah. Yeah, just write down, and in the meantime, let me talk, okay?
Okay.
So now, developmentally, the ectopic location of the kidneys are in the cervical region, then in the pelvic region, and then in the lumbar region. So there are three location of the developing kidney. One is cervical region, means in the neck area. Then kidney goes into the pelvic area, and from the pelvic area finally it ascends into the lumbar area. What is the informations here? The information is, if you don't get the kidneys in the lumbar region before birth and after birth, you scan, so kidneys are not in the lumbar region. Is it possible the kidney could be in the pelvic cavity? Yes, we call it pelvic kidney. Ectopic location, pelvic kidney. Is it possible kidneys are inside the thorax, or it is in between the thorax and abdominal cavity and it is encircled by the diaphragm? Yes, it is possible, because the kidney descends from the cervical region through this line. So the take-home message is, if you don't see the kidney or kidneys in their normal location, so then you must need to look for the kidney in the pelvic location, because the pelvic kidney is a big size kidney and it is a complete functioning kidney. There might be 2 kidneys in the pelvic region, or only 1 kidney is ectopic location. 1 kidney. And is it a functioning kidney? Yes. Pelvic kidneys are functioning kidney. But if it is a pelvic region, how do I know that this is a pelvic kidney? How do I know that? Because number 1, you will see one-sided kidney is missing. And that sided kidney is in the pelvic region. And in the pelvic region, you will see a hypoechoic mass. Then click that mass. Then you will see it is hypervascular and it has a hilum. So you can see in sonographically it looks like a kidney because it has cortex and it has sinus and it has a hilum. Okay, so in that way you can identify the pelvic kidney. But keep that in mind, that pelvic kidney is usually a little small size than the normal kidney size. Okay, so in woman, adult woman, you missed 1 kidney, and that kidney is in the pelvis. How do I know that is a kidney? So keep that in mind. Sometimes the pelvic kidney is identified or diagnosed as an incidental finding. Incidental finding means you don't know before, but suddenly while you are scanning to see something, you found it. Incidental. So now know that female has a uterus and the 2 ovaries. And while you are checking the uterus, and you found that by the side of the uterus there is a mass. You feel like, oh my God, this is a pelvic mass. If this is a pelvic mass, then you can think, is it a fibroid? Fibroid outside of the uterus, pedunculated fibroid. Or you can say it is a other tumor from the ovary, or is it a big lymph nodes or lymphoma or any other pelvic tumor. See, now you have to rule out that no, it is pelvic kidney. How you going to rule out, and what is the most important points that you can say it is the kidney? Because on the corresponding side the lumbar region kidney is absent. When the lumbar kidney is absent, then easily I can feel like that kidney is in the pelvic cavity, it did not ascend. So that is important, and you're going to click the color and you will see the patient has no complaint. If a patient has a pelvic tumor, usually what happens? Patient has complaint, sign symptoms, but pelvic kidney patient, incidental finding, patient had no symptom at all. Now incidentally you got it. Okay, so now I like to give you a little idea about the renal agenesis sonographically, how you're going to know. And if one kidney is absent, then what happened? The adrenal gland on the same side. For the fetal life, you are scanning the fetus, and you got a cross section of the fetus through the kidney area. So this is the spine, 3 ossifying center. So this is back and this is front. So if kidney is normally seen, then kidneys are here. Both kidneys are there. Okay? So that's the way the kidney you will see. Okay? This kidney. And if one kidney is missing, say this is right side, right-sided kidney is missing. So then what are you going to see? Left-sided kidneys are there, and right-sided, we don't see that horseshoe shape. No, we don't see. Then what are you going to see? You will see adrenal gland. This is adrenal gland. Why adrenal gland? I will see. Because on top of the kidney there is a adrenal gland. Okay? This is adrenal gland on the top of the kidney. So if the kidney is absent, so adrenal gland will say, oh my God, there is so much space for me. Then what's going to happen? This adrenal gland will be bigger. And sometimes if you don't pay more attention, you feel like, oh my God, this is kidney. So I saw the kidney, but it is not kidney. It is adrenal gland. If both side kidneys are absent, both side you will see the adrenal gland. If one-sided only present, then that will be compensatory hypertrophy.
If there's a pelvic kidney, does the adrenal gland go in the pelvis
No,
too, or
no,
it stays
no.
up
Now,
there?
very good question. That if the kidney is absent or kidney is in the pelvic cavity, what happened to the adrenal gland? Look, developmentally, the adrenal gland and the kidney, they have two different sources of development and growth. They don't care each other. Only normally the adrenal gland is covered by gyrotous fossa along with the kidney. But when kidney is not there, adrenal gland says, I don't care, because adrenal gland comes from ectoderm. Ectoderm and mesoderm. Okay, so now they have separate source of growth. They say, I don't care. Okay, kidney, you are in the pelvic cavity, oh, stay there. But I am in the lumbar area. If kidney does not form, adrenal gland say, I don't mind. Kidney, you did not form, who cares? I'm going to grow. Okay, that's why you need to know that developmentally they have two different sources. So if one is absent, other will grow doesn't matter, no problem. Okay, so now this is normally, you will see the fetal life. If you miss the kidney, you will see there is no kidney over here. And normally the kidney starts functioning 14 to 16 weeks of menstrual age. 14 to 16 weeks. That's why before that time, you may not say the kidney is absent, or, but if kidney is present, I saw before the appearance of the kidney, means clearly, before clearly seen, you will see this part is little condensed. You can feel that something is growing. Something is growing. So this picture, radiologist wants that picture, so that they can say, yes, something is coming. So if you want to make sure, okay, we will scan after 2 weeks. Good. So that will be the sono images. Then ectopic. Ectopic means you will see one kidney is missing in one side. So one kidney is there, but other kidney here, adrenal gland will be bigger, and then you have to scan in the pelvic cavity. In the pelvic cavity, how we going to know if it is a male or female? Doesn't matter. If it is a female, you will see there is a uterus. There is a bladder over here. This is bladder. This is uterus. Then you will see either side, usually the superior to the uterus or by the side, there is a mass. And that mass has a cortex and sinus. And if you scan in the longitudinal view, you will see the hilum. Click the color, you will see the blood vessels is going inside and outside. Okay? So that's the way you will identify the ectopic. Now, horseshoe-shaped kidney, they will ask question. Each and every one, you will see one question. And horseshoe-shaped kidney, normal kidney is this, right? This is a normal kidney, and the normal kidney has an upper pole and it has a lower pole. In horseshoe-shaped kidney, look at here. This is lower pole and this is upper pole. Now tell me, which pole are fused together? Lower pole. It looks like a horseshoe. And it is anterior to the aorta. It is anterior to the aorta. That means if this is the body, this is kidney, and aorta is this. So this is aorta. This is the renal artery.